Various methods of diagnosing. The first thing is more of clinical evaluation, where we evaluate the patient clinically to understand where the pathology is. Then we run a series of tests. One is CT scan, MRI brain. The most reliable one is the MRI brain, which helps us to localize the tumor. It also helps us to understand where the tumor is, how the tumor is involved in surrounding brain. And of late, the new technology in MRI is that we can also track the fibers, something called as DTI, that is a diffusion tensor imaging technology, where we can localize the normal tracts in the brain. We can assess the relation of these tracts to the tumor. And if required, depending upon the vascularity of a tumor, we also would like to have an angiogram, either the CT or MR angiogram or a digital subtraction angiogram to evaluate the vascularity of the tumor. So this helps us to further help us in the management of the patient. Even with the new technology with the imaging, we can also assess the pathology of the tumor. Previous or 15-20 years back, only once the tumor is biopsied and we send it for the histopathology, then we could get the diagnosis. But now MR spectroscopy, we could analyze whether it's a benign tumor or malignant tumor to an extent, but it's not the final conclusion. The final diagnosis is always again histopathology, but we can actually understand the nature of the pathology by seeing into the MR spectro.